Tonight, Kenyans begin to feel the impact of the nurses' strike as 6 people die in the Coast General Hospital lacking nursing care. The Salaries and Remuneration Commission has rejected the allowances negotiated by the Nurses Union and Council of Governors. So tonight we ask which way out of the current health crisis. We talked to Agnes Munderu, who is the National Treasurer of the Kenya National Union of Nurses, who was also in this negotiating committee, and the CEO of the Salaries and Remunerations Commission, Ann Gitao. Thank you so much both for making time for us. Talk to us. The hashtag is the big question on Twitter. You can text us on 22422. Very quickly, a sample of a few tweets again. We have Valeria Dominic. Hope it will not be like last time. A solution should be found as soon as possible. Is it, Kimani says, is it SRC part of national government together with COG that negotiated the nurses CBA? How can they reject it? Hesbon Masibo, the government should pay nurses. Life is more precious. And Gatetuan Duarte, I think, let's pay them as per the agreement because our brothers and sisters in hospital are suffering. Well, nurses are demanding the implementation of a collective bargaining agreement between them and the Council of Governors that, among other things, offers, and let's take a look at some of those allowances, a health risk allowance of 15,400 shillings, that is up from 3,850 shillings, an addition of 5,000 shillings extraneous allowance to all nurses, a nursing allowance of 20,000 shillings to all nurses, again an annual uniform allowance of 50,000 shillings, up from the current 10,000 shillings they were getting, yearly that is, and a call allowance of 10,000 shillings for specialized nurses, that is on emergency, and also responsibility allowance for nurses performing administrative functions over and above their core work. So all this obviously would increase the salary of the lowest paid nurse, and I'll start with you, Agnes, and thank you again for making time for us. Very briefly, what it will increase the salary of a lowest paid nurse from about what to about what? Average?
From about 40 to 60.
60,000 shillings,
yeah,
if this CBA is implemented.
Yeah. So
now SRC says the amounts negotiated are unreasonable. Yeah. What do you do now?
We wait for them because they give us a mandate to negotiate a CBA with both levels of government, which we did, negotiate a CBA, and we agreed with both levels of government, and where we have listened now for last, we are waiting for the signing of the CBA, because at one point, in a letter dated 17th May, from the Council of Governors, they wrote to us and they told us we give them a date to sign the CBA is ready for signing. We give them a date, the COG, in a letter dated 17th to the Kenya National Union of Nurses. They told us to give them a date which we are comfortable for signing the CBA, and we gave them the date of 25th.
Well, you've heard what SRC has now said.
Yes.
So how is that going to work? Or what will you do now?
We will stay. We will stay outside.
Okay, I mean, we heard you talk today. Did the negotiating team first go against your advice, and why have you decided to take the decision or make the decision you have as SRC?
Thank you, saying first and foremost we must apologize for what is happening. It is not acceptable. It should not be happening because we are all in government. Nevertheless, what the Commission is saying is that we have not received a workable document from the Council of Governors. Several times we have written to them, we have engaged them, and we have requested that we get information as per procedure. And as late as yesterday, we still have not received that information. As you are aware, the Commission works with employers. We do not engage the unions. And the first time this matter came to the Commission was immediately after the December strike. In January, towards the end of January, the Council of Governors, through a negotiating team, approached the Commission and gave its intention to have the negotiated CBA put through. And the Commission met the negotiating team with the Council of Governors representative, and we gave them on the last week of January this year, because this should be on 7th.
Right.
Of Feb.
So you met the negotiating team?
We have met the negotiating team.
You included, that is?
No. What happened, the Council of Governors set a small team to work with the Commission and agree on a number of issues so that when it comes to the signing of the CBA, then we'll not have a back and forth.
Okay, I'll read a text here. Somebody says, does SRC mean that the whole 6 months of negotiations, this is what you're explaining,
yes,
were errors? Were they not involved in the negotiations? Give us a break, Kenyans are dying.
SRC does not involve itself with negotiations. It works with employers.
But you're saying you were supposed to report, they were supposed to, you were supposed to get periodic, it would have been better to get periodic information about how the process is going on, isn't it?
No. Let me put it this way. SRC does not involve itself in the negotiation process. It works with employers. In this case, the Council of Governors set a small team that they were calling a negotiating team.
Did it include the nurses?
It did not include the nurses.
So at no point did you talk to the nurses?
No. We were with the representatives of the chairs of County Public Service Board, and we worked closely with them. They were the interface between SRC and the union.
Okay. SRC says they gave the framework to guide the CBA talks when all the negotiations were going on. You knew this as a negotiating party, isn't it?
Which negotiating part?
You knew being the nurses union in negotiating with the governors, you knew that ultimately, even the governors are saying in a statement yesterday that COG, the concluded draft CBA was forwarded to the Salaries and Remuneration Commission for guidance and for SRC to issue a no objection letter before they sign. That was supposed to happen.
Yeah.
So you knew this was supposed to happen. Either way, SRC was to give clearance.
That was supposed to happen, but the question is, Jacqueline Mogeni, the CEO, Chief Executive of the Council of Governors, did a letter to us on 17th that the CBA is ready for signing. We give them a date. We negotiate with the County Public Service Boards. We don't know the communication between them and the SRC. Exactly. We do not negotiate with the SRC. We negotiate with the employer. So what was going between the SRC and the Council of Governors, we received a letter on 17th that the Council of Governors is ready. The CBA is ready for signing. Give us a date. And we gave them 25th.
Okay, but you knew either way it is SRC to give a clearance, isn't it?
We thought the SRC had given a clearance. Why would they tell us that the CBA is ready for signing? And they want us to give them a date which we are comfortable if they had not received that.
Did you care, as a union, did you care to see if the SRC would... Okay, and we've seen one of John B., who are now with the nurses union, saying he's not the...
you know the John B.?
He's not the chairman,
yes.
And we can even listen to what he said today. You're now saying he's not the chairman
yes.
of the nurses union.
He's not part of the union.
Okay, he is. But he says this strike is illegal. COG says the same because you did not wait for SRC to give clearance, then you decide whether you'll go for strike or not.
Let me tell you, Hussein, we did an agreement with both levels of government in December, which we signed on 14th, when we suspended our strike to pave way for the negotiations of our CBA, which was actually 60 days. It was supposed to end on 2nd March. On 2nd March, the CBA was supposed to have been concluded and registered in court. So we have actually extended our time. Why did we extend our time? Because we are human. We were trying to see whether this strike can be avoided. But they kept on. Let me tell you, we have had more than 5 times to sign the CBA. The very first time when we were supposed to sign the CBA was on 11th May. That was when we had the climax of the nurses week at the Eldoret. And they promised it will be signed so that on 12th we have something to give to the nurses. And let me tell you, when we were launching the nurses week in Isiolo, I told the nurses we have something for you next week on Friday, and we could not even face the nurses in Eldoret because they never even communicated to us. We called the NEC to come and witness the signing, and there was no communication. By the way, the first communication that we have seen from the COG was when we said we are going on strike, and they did a letter, I think, on the 31st.
Okay. At this juncture, it's important to point out that we invited COG to be part of this conversation. They did not show up. They did not send any representative to represent them tonight. To you, Anne,
yes.
You have said you're not going to, you will not issue a no objection letter on these negotiations, isn't it?
We haven't said we will not issue an objection
letter. You
letter.
have not issued it yet.
We haven't issued.
Why? By what amount? Or what was the limit you're expecting? Why?
May I just explain very briefly why we are where we are. I've told you very, very briefly that initially we set up a team.
Yes.
And the team met and gave guidelines, procedures of how to go and negotiate the CBA, procedures that COG's team has had over the years. We reminded them at the end of January. Come Feb, and they write to us, and they ask us to give them parameters. We gave them parameters within 3 days. Actually, by the first week of March, COG had parameters to go and negotiate. And we told them, once you have the parameters, come for a no objection letter. Now they went quiet. Come May, nothing happened in April. Come May, and suddenly we begin getting a flurry of letters from COG asking. The first letter came, give us a no objection letter, but the letter had changed the parameters that we had given them.
Which were?
It moved to these new
allowances.
New allowances.
Up and above, I think, 30 billion.
Let me tell you that when the negotiated agreement was signed in December, the only allowance that was given at that point was a 20,000 shillings nursing allowance.
Yes.
Pending a negotiation under CBA to be signed between COG and nurses.
Right.
So when they came to us, we allowed two things. We allowed a risk allowance to move from 3,850 to 5,000 shillings.
But now it has moved, and we can look at those figures just for clarity. It has moved to 15,000.
That is the new CBA.
That is the new one that you did not...
That we were not privy to.
Yes.
And we don't have a problem with any figures as long as there's harmonization across the public service that the Commission would do. The most unfortunate thing, Hussein, is that as this new CBA comes, consistently, it does not have availability of funding proof. So we told them, go get us a proof of availability of funding, whether it was from internally generated sources or from Treasury. Once you do that, we should be able to proceed. That did not happen last week. That did not happen the other week. And so come Monday, they still write to us and we tell them, this is the situation. We have your CBA. Please let us have proof of availability of funding.
That is why you cannot issue an objection.
That is why we cannot issue
letter. So what do you do now? They can't issue an no objection letter without proof of funding.
They still have time.
Who as COG?
The COG, the SRC, the Ministry of Health, the government, the nurses will wait. One thing, we are dealing with a very insincere government. We negotiated a return to work formula in December. A nursing service allowance, how many months was it paid? It is no longer there.
How many months was it paid?
It was paid in January.
That is
nursing service allowance. Nursing service allowance. I am not talking about health services allowance. I am talking about nursing service allowance. It was only paid in January. It disappeared. So, are we going to trust them? The nurses are not on strike. The government is on strike. Where is the COG?
What are you going to do now?
We will wait.
You'll go on strike?
Yes,
I mean,
the strike
you're not going to resume until what happens?
No, we are not going to resume until, if it is going to be 100 days, the government, the SRC, they know where they'll get part. We know our country is rich. If they want the campaigns to end,
regardless of the suffering of people in hospitals.
The government, we can see the politicians are still doing their campaigns as if nothing has happened. They are comfortable.
Okay. The Labour Ministry has now called for a conciliatory meeting between you and COG, the union. Are you going to attend that? That is tomorrow?
No.
Why?
We have not registered a dispute. As we agreed with the employer, we were not negotiating with the COG. We were negotiating with the county public service boards, not the COG. If the COG has a dispute,
so you're not going to attend that?
No.
Okay.
We are not going to attend any meetings. We will only attend a signing of the CBA.
That is the only way out of this?
Yes. Nothing short of that.
I don't know if you can respond to that. I'm
yes.
sure you're not part of the negotiating team. You shouldn't. But what do you think should be the way out of this?
Let me talk before she talks. It is not everybody who is on strike. It is only a section of the health workers. Why are the hospitals closed? Why are the hospitals closed? We have always said that nurses should be placed some places higher, but we have always been told that we are equal to the others. Why are the hospitals closed? If we are equal to the other people, why are then the hospitals running? It is only the nurses who are out. When they go away, I think like
the harmonization she's talking about.
The 17 we have 17 cadres in health. It is only the nurses, 1 out of 17, which is on strike. So why are the hospitals not running? When they go away, we manage the hospitals. The hospital don't close when other people go away, so long as the nurses are there. But when the nurses are not there, the hospitals close. So who is this nurse? Who is this nurse who paralyzes health when 16 other cadres are working? Who is this nurse?
That's why you think they should not be subjected to harmonization. And
we are supposed to be treated as a special cadre. If hospitals can close when we are not there, then we are the hospitals. We are the heart that runs the hospital.
Okay.
Yes.
Hussein, the commission is open to anything that will make the nurses go back to work. I would appeal that the Council of Governors comes on board. The Council of Governors engages the nurses. within the procedures and parameters that are set. The commission is open, the commission is willing. We would want to see the nurses go back to work. We would want to see the suffering of Kenyans alleviated. And if there is a meeting that the commission would be called to that would bring us towards that, we are ready anytime.
But the figures under the negotiated CBA as they are now cannot work.
We are not saying the figures
until you get
work.
Proof of funding.
If
That's
we
what you're
get
saying.
the proof of funding and we are able to harmonize across the public service, we will do that. But the employer has not given us that. And the employer is the Council of Governors. We have been waiting. We have requested for this information since Feb.
Okay. Yeah, finally.
Finally, I would want to say that we are also concerned by the suffering of the Kenyans. That is why we gave the negotiations up to June, when it was supposed to end in March. But we have seen that there is the government is not sincere. We feel the Kenyans, and we also hope that it could be sorted even tonight.
Okay. We'll leave it at that, and we hope for a quick solution to this. Keep talking to us. The hashtag is a big question on Twitter. You can text us on 22422. Agnes Munderu is the National Treasurer, Kenya National Union of Nurses, and Anne Gitau is the CEO of Salaries and Remuneration Commission. Thank you both for making time for us tonight. We're back after this.